Have you ever been lying in bed, just desperate for sleep, but your legs have other plans? You get this overwhelming, kind of maddening urge to just move them. If that sounds even a little bit familiar, well, you are definitely not alone. So let's dive into this and figure out what's really going on. And that quote, man, it just hits home for so many people, doesn't it? It's been described in all these ways: crawling, pulling, like a weird tingling, sometimes even like a zap of electricity. It's a feeling that is just about impossible to ignore. So, what is this thing? Is it just nervousness? Are your muscles messed up? Is it all in your head? Nope. Today, we're going to pull back the curtain on the real science here. And you might be surprised to learn that it all starts in the brain. Okay, first things first. Let's be really clear. This is not just you being fidgety. We are talking about a recognized, real-deal neurological condition. This is restless leg syndrome, or RLS for short. And for a doctor to diagnose it, they're looking for 4 key things. 1, you have this powerful urge to move your legs. 2, it gets way worse when you're trying to rest. 3, moving your legs, like walking around, makes it feel better, at least for a little while. And 4, that urge always comes with these weird, uncomfortable feelings. And the most important thing to get here, this isn't a leg cramp. It's not a muscle problem at all. It's a signaling issue that's coming from your brain. But why, right? Why does it almost always kick in at night when you're trying to sleep? Well, it's kind of like a perfect storm inside your body. As you wind down for the day, your brain's dopamine levels, that's a chemical that helps control movement, they naturally take a little dip. And because your body is finally still, all those strange signals from your brain suddenly feel way, way stronger. It's this combo that creates that awful urge that just keeps you awake. Now, to really get this, we need to talk about a related condition that gets confused with RLS all the time. Understanding the difference is super important. And that's this: PLMS, or periodic limb movements. Now, here's the big difference. Unlike RLS, these are little repetitive leg jerks or twitches that happen only when you're actually asleep. There's no urge because, well, you're not awake to feel it. It's an automatic, totally involuntary thing your brain is doing. And this chart just lays it out perfectly. RLS is what happens when you're awake. It's that awful feeling that prevents you from falling asleep. PLMS happens after you're already asleep, and it's what causes you to wake up over and over, sometimes without you even realizing why. But here's the wild part. Somewhere between 70 and 90% of people who have RLS also have PLMS. They're different, but they are very, very connected. Okay, so we've got the what, but now we need the why. Why is this happening? And the answer is pretty fascinating. It comes down to some very specific chemistry in your brain. To figure this out, we need to look at 2 key players inside our nervous system. These 2 things are in charge of how we move and how we feel sensation. The first piece of the puzzle is dopamine. You've probably heard of it. It's a super important chemical messenger in the brain that helps control muscle movement. Now, with RLS, it's not that you don't have enough dopamine. It's more like the brain's system for using it gets a little out of whack, especially at night. And what does that dopamine system run on? What's its fuel? This is the second and honestly the most critical player in the whole story: iron. Your brain absolutely needs enough iron to make dopamine and to make sure the dopamine receptors are working right. If you don't have enough iron in the brain, the whole system can get thrown off. And this number you see here, 75, is incredibly important. It's not your regular iron level, it's your ferritin level, which is a measure of how much iron your body has in storage. You see, you could have a standard blood test come back and say your iron is normal, but for the brain to function properly when it comes to RLS, research shows your ferritin needs to be above 75. Anything below that, and your brain might be starving for the iron it needs, even if you're not officially anemic. So if you're listening to this and thinking, wow, that sounds like me, how does a doctor actually figure it out? Well, the path to getting a diagnosis is actually pretty different for RLS versus PLMS. For RLS, there's no fancy scan or blood test that says you have it. It's what we call a clinical diagnosis. That just means it's based entirely on you describing your symptoms to your doctor, that urge, it being worse at night, and feeling better when you move. PLMS, on the other hand, you can only diagnose with an overnight sleep study where they literally count your leg movements. If you have more than 15 an hour, that's a diagnosis. Now, are some people more likely to get this? For sure. RLS has a huge genetic link, so if your mom or dad had it, your chances are way higher. It's also really common during pregnancy and in people with chronic kidney disease. And, no surprise, low iron levels are a major risk factor. Even some common medications, like certain antidepressants or even Benadryl, can make symptoms flare up. All right, let's get to the most important part. Understanding this stuff is great, but finding relief is the real goal. And the best news of all is that this is absolutely treatable, and there's a very clear, proven way to go about it. So there's a clear order of operations here. Step one, always, is check your iron, specifically that ferritin level. And the goal is to get it above 75. For a lot of people, that's it. That's the fix. If that's not enough, you move to step two, lifestyle tweaks. Things like cutting back on caffeine, doing some gentle stretching before bed, and having a solid sleep routine. And only if those first two steps don't do the trick does a doctor move to step three, medication, where drugs like gabapentin are now the go-to. And there's a really critical reason for that order. See, some of the older medications that worked directly on dopamine could actually backfire after a while. They could cause this thing called augmentation, which is a terrible paradox where the treatment actually makes the RLS worse. The symptoms start earlier in the day, they feel more intense, and can even spread to your arms. It's a huge problem, and that's why the guidelines have shifted. So, after all of this, what's the most important thing to take away? If these feelings, this struggle, is your reality, I want you to know this, first and foremost. You are not alone. This is so common. Second, I want you to hear this loud and clear. You are not imagining it. This is a real physiological, neurological condition. There is science behind what you are feeling. And finally, the most hopeful and important message of all. This is treatable. There is a clear path forward to feeling better and finally getting the sleep you deserve. Understanding is always the first step. The next one is talking to your doctor. So the only real question left is, are you ready to reclaim your rest?